Hello, I'm Kate McCracken. I'm a pediatric and adolescent gynecologist within the Department of Obstetrics and Gynecology at Michigan Medicine. I love providing pediatric and adolescent gynecology care because it's a privilege to educate and empower young patients. And so I do that through medical care and surgical care. And the cool thing about working at an academic center like Michigan Medicine is that I can help educate the next generation of physicians to provide this care. Sometimes people don't completely understand what pediatric and adolescent gynecology is. I'm not a pediatrician and I don't deliver babies. I'm a gynecologist who provides comprehensive reproductive and gynecologic care for children, for teens, for young adults, and that covers a wide variety of conditions. I think sometimes it's important to note, too, that I provide that care in the office setting, so medical care, and sometimes in the surgical setting. So we're doing surgery for specific conditions as well. I would like patients and families to know that I'm here to listen first, understand what they need, and then use my expertise to work together with them to create a care plan that meets their needs. I love working here, and the team approach that we have at Michigan Medicine is excellent. It's really valuable to work in a team setting, and Michigan Medicine allows us to do that. Put the patient and the family at the center of that care, but wrap the specialists around them is really cool. It's a really great part of this organization. Coming to a gynecology appointment can be a really vulnerable experience, and an experience that might evoke some anxiety in a patient. And so you really want to have a provider that understands that and listens to you. So when I meet a patient for the first time, making sure that the patient knows that they are in control, that they are in a safe space, that we provide care in a really inclusive, non-judgmental, and nurturing fashion. And we are so happy and really honored to be able to provide that care for them. Frequently, patients ask me if they'll need an exam when they come to a gynecology visit. And for this age group, it's often not necessary. There are certain reasons why we might need to do an exam. One of the things I love the most is providing education to patients and empowering them with that information so that they can lay the foundation for a healthy life as a child or a teen or a young adult, and that will carry them through their entire life. Giving that anticipatory guidance about what to expect as your body's changing and what's normal and what's not normal. Or typical or not typical. And helping the patient feel empowered and comfortable in their own body is something that I do every day in my job. And it's really a cool, exciting part of what I do. We also do amazing research within our department. And so we help advance the field of pediatric and adolescent gynecology. Sometimes we know answers to clinical questions for an adult population. Children and teenagers are not just little adults. And so some of our research uniquely answers questions that affect them. It's a goal of mine as a pediatric and adolescent gynecologist that patients lead happy and healthy lives. And if I can in any way help them and empower them to do that, it's an honor and a privilege.